show
of
you
all.
that.
I'll say it. I'll say it so you know. What happened? That was like a spaceship.
Just saw. One moment. I think it was picking up live from another footage. It's
I
feedback.
took pictures in
Mine is like
and even with just the small what was
That little
added,
teeny bit, yeah,
it
made
made
it different.
such a
Good.
difference. I brought it to show you.
Oh,
Like, it
really?
made
Good.
such a
I love
difference.
that. I love it.
Cause it's wider now at the cheekbone. Like it's,
I love your cheekbones, right?
I love
your
it.
cheek
Looks
eye
so
area.
good, yeah.
Full junction, it's
Yeah.
perfect. Now we just do a
With
little
this,
hair.
I was going to ask you, this little dent here for choosing.
All right, Dr.
Is it
Emer.
fine or is it
It doesn't
rubella?
Doesn't really
You
matter.
see where I mean that?
Yeah,
It's because of that tendon.
All right, Dr. Emer, we are live.
Hey guys, it's Dr. Emer, and we're doing one of my favorite treatments today, facial rejuvenation, female facial sculpting, but we're gonna focus on a specific area, the temples. Take a look at mine. I work out a lot, I lose a lot of volume. I need filler too. I just haven't ever done filler before. Yes, I know you guys, I do a lot of filler on other people, but not on myself. And so we're gonna do filler on my patient today who is very youthful looking, has great volume, but now we're gonna work into another area, which is this area. Now, she doesn't have an issue there necessarily, it's just what happens with women and men as they get a little bit older, you lose volume here. And what happens when you lose volume in the temple? Your eyebrows come down. It doesn't allow the connection between the upper and middle face. It looks a little less youthful, and it honestly it makes people feel you're a little less healthy, even though it's not something you would be talking about, they just perceive it that way. So we're gonna inject the temple, lay back and relax. I know it's hard to do. And everyone gets nervous in this area because it's around the eye and there's some veins. This is a very safe area. We were talking about it the other day, Jordan, about the layers in the temple, right? We were
Yes.
talking about it. And where are the blood vessels? They're on the top. And where are we injecting? On bone. So if you know exactly where to go, count of three, 1, 2, 3, we're gonna go all the way down to the bone. It's gonna feel weird. She's gonna be totally safe. Now we're in a safe plane. And what I'm doing is I'm using Restylane Define. The reason I like this is it's gonna give a lot of volume and structure and lift, but it's gonna be soft. So it's not gonna look overdone. It's also gonna help lift the brow, which I'm gonna do right now. I tell people the temple is like a swimming pool. You have the end that you walk into and the end that you dive into. This is the deep end, the superficial end. So we're gonna do it in the middle first. Just take a quick look. Always do real quick, everything was great. And I'm now gonna go a little bit more into the superficial end right here so I can lift the brow. It just feels weird because you're going through a muscle. So this is gonna give some volume in this fusion, we call this the temporal fusion line. And it's gonna lift this brow as well, slightly, not crazy, but just support, because as we get older, you lose that support. And then lastly, that's basically one more to go. Look at that, already, significant improvement. We couldn't go down to the deeper temple, but actually I'm really liking how the superficial part is filling out, so we're gonna focus on doing that a little more. And we're using a syringe. I usually tell people 1 a year per side is what really helps. Great, so now take a look, I'm gonna show you both sides. Look at the one side that's completed versus the other side that's not. We'll switch. Very safe. But take a look at the difference. Let me show them straight. Oh yeah, it's huge, you can see. Take a look here, take a look here. What do you notice? The bony ridge above the eyebrow is very defined here. On that side, it's blended into the cheek area to temple. We call this the OG curve. This area here is very soft now on that side, but here there's a separation. These are just simple signs of harmony of the face. So you guys can see it looks great. Okay, so now we're gonna go to the other side. It's perfect. So now again, we're gonna go to the middle part of the swimming pool, all the way down to bone. I know it feels weird. Perfect. And just go really slow. Looks great. And so this is something I tell all my patients to start early, because this gives a lot of support to the face. This helps prevent a lot of aging in the upper face. And it overall just blends everything better. Okay? And then the one thing that you need to know is tomorrow she may feel a little pain when she chews because we're going through the muscle here. Look at that improvement already, half syringe. See that? But this part still has volume. This has volume, this does not. So let's work our way up. Weird feeling here. I'm gonna go a little closer to her brow on this side. And we're gonna work our way back, one more pinch. done. So now what do we do, Jordan? What do we do?
We're gonna do the Emer reveal.
I'm gonna reveal. I'm gonna do it right now.
All right, so
Yeah,
we're
we
gonna
give
pass
her a
our
little
patient the camera right now.
Because
We'll
this
see
is
her
great.
reaction.
And I love this because temple is immediate. And yes, there's a little bit of swelling. It sometimes look a little puffy, but it goes down. And I like it because it's immediate and blends everything and people feel great when they leave. Okay, so let's show her. Go ahead and give her the mirror. Obviously there'll be a little pinpoint bleeding, but nothing crazy.
Wow, what a difference.
What do you think?
I look like my 22-year-old self.
See, there you go. 22, don't age yourself. You're 21, we know. Okay, so that's it, you guys. Here, lay back a second so I can show them. And now, if you take a look here, remember before I showed you that bony ridge, no more, right? You see, it's all blended now into her cheek. So when she smiles, it just looks more youthful. And it's perfect. So that's temple filling with Restylane Define. Great. You did awesome.
Thank you, guys.
You feel